Hi, my name is Connor Howells and today I'll be completing Practical Assessment 18, performing a blood smear. Before I begin, I have washed my hands under warm soapy water for at least 20 seconds, and I have applied minimal PPE wearing disposable gloves. This helps to create a microbial barrier between myself and the patient's sample to ensure I don't expose the sample to any potential contaminants while doing the diagnostic testing or the blood smear. So, before I begin, I have collected all of my appropriate equipment. I have my blood collected in a EDTA anticoagulant tube. This has been collected a few days prior, so it has hemolyzed quite a bit. However, just to simulate the blood smear video, it will be fine. I have a kidney dish and I have some distilled water. I have a 1ml syringe and a 25 gauge needle to appropriately drop the sample. You can also use a 22 gauge black needle. I like just the 25s. I've got the two microscope slides, so one is my spreader and one is for my spear. I've got my stains here, which is all ready to go. I want to check the cleanliness of the microscope slides beforehand. So you want to remove any fingerprints or any residual that remains on the microscope slides, making sure that both sides are completely clean before using. This includes the smear slide and the spreader slide. Great, and that will get discarded in the general rubbish bin. So now I will open my 1ml syringe here aseptically. Checking for package integrity of the needle and syringe itself, making sure it wasn't open prior and it maintains sterility. Connect that one on there. Those two get discarded in the general rubbish bin. Then remove the top of the EDTA tube, and we want to collect a small sample. So I like to just pop that one in and draw back. Look, you don't need a lot of blood at all, just a very small amount. You kind of don't want to get air pockets in there, so try to do a clean draw. Now I'm going to place a small drop of blood about a quarter of the way in from where you can write on the microscope slide, and then we will start the blood smear. So I'll do a very small drop. You don't need a lot at all, or that might be a little too much. Now, at a 30 to 45 degree angle, we will get the microscope slide here, and we will hold it, making sure that it encases blood at the bottom of the slide, and then in one quick smooth movement, we want to move along. So now we have completed our blood smear. We have to let it wait for it to dry completely before staining and then evaluating under the microscope. Looking at the blood smear itself, it is a little thick, especially in the middle there to the end. We've maybe got a little bit too much blood. However, it is quite okay for the simulated test that we're doing now. If you aren't happy with it, you may have to retry it a couple of times to ensure that your smear is correct. For diagnostic evaluation, you're looking for about a quarter from the label area, and about 2/3 of the microscope side itself is ideal. I am a little thick here at the edge, maybe because I had a little bit too much blood at the beginning of the smear, which has caused that. It's not too thick, but it's not too thin either. So you want a good balance between the amount of blood that you have. You don't want too small or too little blood. So that sample is completely dried there, and now we will begin by staining our slide. So we'll remove our first stain, our fixative stain here, and we are looking for 5 1-second dips. We are wanting to go direct, straight down, up and down in a vertical motion with 5 1-second dips. So 2, 3, 4, 5, maybe one more because I'm not happy with that. Let that drip off into the fixative and move to the red stain, the Earson stain. Then the same thing, we'll do 5 1-second dips. 1, 2, 3, 4, 5. Now let that drain off as well, because you don't want any of that residual stain to be dripping everywhere around the lab. A gentle tap, place the lid back on to prevent exposure, and again, 5 1-second dips into the blue stain. And one more. Great. Let that drip off into the stain. Put the lid back on, and we can pop back there. Now, you want to remove the cap off your distilled water, and very gently, you want to rinse off both the back and the front of the stain without disturbing the sample in any way. Before we begin, we will turn on the microscope here, making sure that the light is on. We then want to make sure that the stage is set to the lowest power, which it is, and all of the way down. Then we want to be looking at the rheostat here and making sure that it's not too bright, which it isn't. And then we want to get our microscope slide here, and we want to gently open the lever here and load in the microscope slide. I will just grab that one now, just to show you. Now to begin, we're on the 4 times power. We want to look through, and we want to be using the coarse focus only until an image comes into view. We have an image now, and I'll move to my next power, which is the 10 times. Then, you don't really need to touch the coarse knob at this time, generally only the fine focus. Now we want to be moving to the 40 times, the next power, being very gentle, using only the fine focus. Or it might be easier to show on this side actually, that I am turning the knob. Now, want to be moving to the next power, and this is the 100 times power. So gently, want to move halfway around. Then we want to get our immersion oil here. We want to place a small drop on the center of the smear. Just 1 drop. Just don't think we have a lot left of the oil, but that's okay. And then you want to bring the 100 times power around, being very careful as you do that to watch, making sure that it does not come into contact at all with the microscope slide or the microscope cover. Great, that one is all done now. Now you don't touch the coarse focus at all, only the fine focus. Now, that has all been set there. That is all ready for microscopic evaluation by the vet. I'll notify him now. I'll also label the sample with the correct patient details. Now, after microscopic evaluation, we'll have to correctly clean and dispose of the microscope slide here and clean the surrounding area in the lab. So to do that, we will bring the stage to its lowest, bring the power around to the lowest power, gently remove the blood smear sample, and we'll place that and discard it in the sharps container. We will turn off the light, and then getting a Kim wipe, we'll give it a good wipe over of the stage underneath the microscope head, especially under the 100 times power, as it may have come into contact with the immersion oil. To finish, all the lights off, the rheostats down, and we will conclude by placing the dust cover over the microscope. But other than that, that is everything for today. That is Practical Assessment 18, performing a blood smear.